Well, hello, everybody. This is Paul Feuerstein, the editor-in-chief of Dentistry Today. And today we're going to talk about periodontal disease. And I'm lucky to have my friend Richard Nagelberg here, who's a dentist in the Philadelphia area. He's been all over the world, to be honest with you. He's been in Thailand, Cambodia. I think he's been up to Newfoundland, Canada, as far as I know. He's been on many advisory boards in a lot of companies. He's actually been a columnist at Dental Economics, which is actually where I was years ago, I have to say. And right now, Rich is the Director of Medical Affairs for OraPharma, which is a division of Bausch Health Pharma. So, Rich, before we get into the details, how are you? I mean, how you
I'm
been
good.
the last 2 years?
I'm well, thank you. How about yourself?
It's been a challenge. I mean, this is really,
Yes,
from
it
a
has.
practicing standpoint, from the world standpoint, and every day a new piece of news pops up. And it's like, oh, here we go again. It's like,
Yeah, it's a little tiring, but we keep soldiering on.
yeah, we have to. And I find that I personally, and I'm sure you do, as a resource to our patients, because they have questions, and we're medical people. They say, what does this mean? What's this new virus? What's this thing? How does this work? So I think we owe it to them to at least be very scientific and non-political about the whole discussions that are going on. And that's
Absolutely, I completely agree. And people are coming in with a high degree of anxiety, and
absolutely.
and they just don't know what to think. And so as dental professionals, it is our responsibility to address those things and help make them feel more comfortable and come into the dental office to get their care.
And that, no doubt. So anyway, you're working with OraPharma. So let's just talk about OraPharma for a second. There's a very easy website. It's called OraPharma.com. And those of you who think you don't know who OraPharma is, yes, you do. They're the ones that make Arrestin. That helps us take care of patients with periodontal disease. And that's been around for years and years. And we all have a little squirty thing. We shoot it into the pockets and follow it through, and we're getting results, which is really nice. It's been a great product. OraPharma is a little branched out a little bit into bone grafting with a product called Osix, I believe. They're working with some clear aligners now, OraFit. So just as a quick thing, if you go to their website, orapharma.com, there's a lot of information about what they're doing. But the nicest part of their website, and Rich is part of this too, is the professional education section. So if you go to the professional education section, there are just video after video of things that'll help us, things that could help you with your patients. And so that's online. But Rich is here to talk about something else. Let me turn my phone on for a second. And there's something special on my phone right now, something brand new. And why don't you tell everybody what I put on my phone?
I will. The app is called MyPerioHealth, and the app digitizes the AAP staging and grading guidelines. The AAP came out around 2018 with the staging and grading guidelines. There's a lot of misconception about this, and it's a very cumbersome process, which is a reflection of the complexity of periodontal disease. So we understood that there was a need. Many offices were not going through the staging and grading, which means their patients were not realizing the benefit. And so we realized there was a need to streamline and automate the process to arrive at the stage and the grade. So that's the reason why we undertook this. It was 2 years in development. It was extremely complex. I had multiple, weekly calls of 4, 5, 6 hours with people I work with on the development, and we finally got it across the finish line. And what it does is it streamlines and automates the process. So if you're trying to stage and grade manually, it's very difficult to figure out where all the data goes, the pocket depth, the bone loss, and so on, where it goes in the staging and grading grids, and then how to put all that information together to arrive at the proper stage and grade. The app automates the whole process. You just drop in the data and push a button, and it comes up with the stage and grade.
Yeah, I'm looking at it right now, and it says periodontal assessment, start here. And there's also a nice little video on there right now, and I'm sure there'll be some more coming on an explanation for your patient to say, what is periodontal disease? I mean, one of the issues that we have is dentists and hygienists and assistants. You say to the patient, well, you have bone loss, you have periodontal disease, and they go, look at you, yeah, whatever.
Exactly.
It doesn't hurt. And, my gums bleed every once in a while, so I must be okay. And it's not.
We hear this every day of the week. Absolutely true. The reason why they came with the staging and grading is staging and grading describes the severity and extent of the patient's case of periodontitis and the prognosis, or the rate of progression. So there's so much information to be gained, and it's all patient facing. So that, the dental practice is going to get the stage and grade and then use that in the treatment planning and the maintenance interval for the patient's benefit.
And the progression.
And the rate of progression. That's exactly right.
Yeah. So it's not, is it actually a tool for diagnosing periodontal disease?
It's a really good question, Paul. Really good. It's not a diagnostic tool. You still have to go through the periodontal evaluation and the radiographs, same as if you're doing the staging and grading manually. You have to do this for the app as well. And then you arrive at the diagnosis. There's only three diagnoses possible: health, gingivitis, or periodontitis.
I see.
If there's bone loss, as evidenced on the radiograph, most notably, then the patient has periodontitis. It's only those patients with periodontitis that go through staging and grading. Health and gingivitis patients do not go through staging and grading.
I see.
So it's not a diagnosis. It's to describe the severity, extent, and progress of the disease.
So let's just clarify this a little bit. So who's the one that's downloading this app?
It's downloaded by it's patient facing. So it's going to be done by the dental office, the hygienist, the doctor, and so on.
Mm-hmm. So you can code the patient's name in on the app and keep track of it there.
Actually, we do not keep track of any data. So the patient would put their initials in. It's totally HIPAA compliant.
Perfect. That was my question.
We don't store any information, the patient's name, date of birth, no patient identifying information whatsoever.
So this is a useful process for us to use.
Absolutely.
That's really something. Now, what's the cost for this app?
Zero. It costs absolutely nothing, and it's non-promotional.
Yeah, there was nothing on it about OraPharma.
Yeah, it's non-promotional and it's no cost whatsoever. I mean, we did this because it was very clear that the dental profession was not implementing the staging and grading because of how cumbersome it is, and we realized there's a need here for the patients, and so we decided let's make this happen.
Boy, that's great. So when you're using when you're inputting the information in the app, is it something a solo person could do, or do you need a person to dictate to, or how easy is this?
This goes right to how you use this. The app is intended to be used. The patient's in the hygiene chair, and they either have a cell phone or a tablet in their hand. The patient is going to input all the information themselves. This is the first time ever the patient participates in the discovery of the disease.
Wow, self-discovery.
So historically, patient comes in, we exchange some pleasantries, we lean him back in the chair, and we use a perio probe and we take x-rays, and then we sit them up and we look at them and we say, you have gum disease and this is what we're going to do. And so the patient's been a passive participant. Now the patient is going to be an active participant. So the app asks things, by the way, all dictated by the AAP guidelines.
Mm-hmm.
What are your initials? What is your age? Are you a smoker? Are you diabetic? And then when it comes to the clinical parameters, like the worst pocket depth, the amount of bone loss, clinical attachment loss, the hygienist will prompt the patient as to the answers after he or she has done the periodontal evaluation and charting and looked at the x-rays. Patient inputs all the data, hits the button, and it comes up your stage 3 grade C, or whatever it happens to be. And all along the way, there are explanations of what the various parameters indicate. So it's tremendous opportunity for communication and education of the patient.
That's really something, because like you said, you're sitting there trying to explain bone loss and inflammation and pockets and things like that. But this is, it's if you go way back to Dr. Robert Barkley, this is a zillion years ago, he believed in, you give the patient the information, let them figure out what's wrong with themselves. And I think this fits right in that. This fits right in there.
It fits right in there. I mean, this whole process of the patient's going to be a proactive participant in the disease realization or discovery, in my opinion, sets the whole model on its end. Because the patient's participating rather than just laying back, and then we sit them up and say, this is what you have.
I have to ask this because I haven't really gone through the whole process myself. How long does this assessment take, roughly?
2 minutes.
Okay, because as a hygienist, they sit there and say, "Oh my God, another thing we have to do."
It would take 2 minutes. That's the whole thing. That's the whole thing. You just literally just drop in the data that you got from the periodontal evaluation, the worst pocket depth and so on. And you just drop in the data, hit submit, and up it comes instantaneously.
And it's also nice. I mean, as you know, I work with all these digital tools, and sometimes we actually turn to them on purpose and say, well, I think this, but let's check out the computer, see what the computer says. It's a virtual scientific second opinion. And it's sort of, I think it's a great reinforcement for the whole process too.
Yeah. I'm sorry. It makes the dental healthcare professionals' job so much easier. It's just inputting the data and coming up with it automatically. It's great.
So I guess the bottom line is that we can now tell people that they can go to the Play Store or whatever it is on your phone, or is it an iPad also?
It's available on every device. So it's on iPhone, iPad, Android devices, cell phones, and there's a web version. It's www.myperiohealth.com. So you could get it on your laptop,
on
your cell phone, on your tablet. It's in the App Store. So it's very widely available at this point.
Great. So it's myperiohealth.com, or MyPerioHealth is in the App Store. Also, again, let's keep our eyes on OraPharma.com too, to see what's going on there. And don't forget about their professional education library too. So all I can say is, I just put it on because Rich told me about it. I'm going to start working with it as soon as I get back to the office and try to figure out what it means. And I want and see, this is all about patient communication that we do all day long. And if something's going to make it easier for me to explain something to a patient. Wow. That's great, Rich. So thanks for working so hard on this thing, spending the last 2 years of your life, every waking minute, getting this thing together. No,
thank you very much. This has been really enjoyable. I appreciate the opportunity.
So thanks very much. And if you have any feedback, let us know.
Will do. All righty, you too.